O te whatalofa tumalo whalalo whawhonganga le tunu o le pokalame nei le sui mai le Malaghan Institute of Medical Research o mawhatasi tai au nei ma Dr. Tom Mules o ia o stasi whainga ruenga clinical consultant and gastroenterologist i le Malaghan Institute. Matatano atu nisi o ngā ruenga lo whea ngai ma nato a mese susu e ngā whaasai nisi mo le soifua maloloi no tātou tangata. Talofa, and welcome to Samoa Capital Radio. Tom.
Kia ora.
Yeah, how are you this morning?
Very well, thank you. Thank you for having me on the show.
Oh, we're always delighted to have people like yourself to come and explain some of these things to our listeners. Now, we've been telling the community we're discussing hookworm, and hookworm, we resonate with that because in my case, before I left Samoa, I was told to take some pills, make sure I don't come to New Zealand with my hookworms. And then when I got told by Professor Lacrosse that the Institute was doing a research, and I thought, well, let's have that topic on Samoa Capital Radio because we're familiar with that. And you are part of the study.
That's right, yeah.
So why are you doing this? What's interesting in hookworms? Why are you researching the hookworms?
Good question. So what I would say first is we think there are good worms and bad worms. And when I talk about worms, I'm talking about parasites.
Yeah.
And so hookworms is just a particular type of parasite that we're very, very interested in because what we're seeing worldwide, but very much so in New Zealand, is this huge increase in autoimmune and auto-inflammatory disorders and allergic disorders. And so what I mean by autoimmune disorders is where your own body's immune system is attacking your own organs. And one of the theories for that is that your immune system has become overactive. And there's lots of different ideas about why that might be. For example, this idea of the hygiene hypothesis. So that is less infections when we're a child because we are becoming more sanitized, cleaner, means that our body's immune system isn't as regulated. So it gets out of check and so it's more active. And so that increased activity means that it starts recognizing our own organs as foreign and starts attacking them.
Yes, I remember talking to a doctor once at a hospital and I said, how come we got a lot of our young Pacific people coming here for skin
So
problems?
eczema is a prime example of that,
Yeah,
and asthma.
Yeah, and yet us who were born in Samoa, we don't seem to have it. And he said, because you were exposed to a lot of germs and stuff, so you're well immune. And the little ones that were born here, they're well protected.
Absolutely. So, yeah, I mean, we're seeing this worldwide, this increase in these inflammatory autoimmune conditions. And this hygiene hypothesis is one theory. The other, and kind of underneath that, is this old friends hypothesis. And one of those old friends might well be human hookworm. And that hookworm is actually a good infection and may help the immune system to keep it in check. And that's why we're interested, because could this be used to treat diseases?
So you're trying to find out what good work the hookworm is doing inside our bodies.
That's right. I mean, what I would say early on, and this is really important to the listeners, is that we're not sure if hookworm is beneficial.
Right.
If we look at where hookworm is endemic, so where there's lots of hookworm infection, places like the Pacific Islands, places like Asia, they have much lower rates of autoimmune diseases. But those rates are going up in those places as they become more sanitized, more urbanized. And that's because maybe the amount of hookworm infection is reducing, but probably lots of other infections are reducing as well. So we don't think hookworm is necessarily the answer, but it might be the answer, and so that's why we're really interested in it. But the other thing is that hookworm can be bad, and if you have too much hookworm in you, that can lead to abdominal symptoms, pain, diarrhea, and weight loss. And so particularly in children, I do think it's a good idea that they get hookworm treated, they get parasites treated, because it can lead to not putting on weight and lots of symptoms. And so I'm not saying hookworm's good all the time, but can we harness the power by using a little bit of hookworm to just keep these diseases away or keep them at bay?
Yeah, if only you can regulate how many you should have inside you, that would be good for you.
Well, that's right, and that's a really interesting point, because in New Zealand we don't have hookworm, and that's because for hookworm to infect other people, the eggs need to be in the soil, and they need warm, tropical type soil to become larvae, which then can infect people. We all know that New Zealand, particularly Wellington, isn't warm and tropical, and so those eggs die straight away as soon as they make it into the soil. But you know, somewhere warm and tropical like Samoa, there are hookworm larvae in the soil, and so people can get infected, and people can get lots of infection. But whatever dose we give someone at the Malaghan Institute is the only dose they're going to have, because they can't pick it up from elsewhere.
So, did you inject yourself with hookworms?
Yeah, so the hookworm life cycle is really interesting. So hookworm eggs are in your poo if you're infected with hookworm. They end up in the soil where they develop into these little tiny larvae. Whereas if you're walking in that soil, say with bare feet, and your skin touches those larvae make their way through the skin and go through the blood to the lungs. In the lungs, they grow into bigger larvae, mini worms, and then they crawl up your windpipe, up your trachea, and then you swallow them. Then they go down into your gut, and that's where they set up shop, and they just feed off a tiny little bit of blood, and can live there for years. And then you obviously produce eggs, and that's how they infect other people. So they've got this tiny little thing, it has this amazing story as it makes its way through the body to where it wants to live.
And it doesn't have to be too cold. So what we need to do is bring down the weather in the Pacific so that they don't survive.
I don't think you want that.
Let me try and explain all of this to you. So far, Tom, thank you for that. Ole tato maro whalongia ole scientist Tom Mules. O ia e ngalue I whafo mai. Mai whapitola na ngaluenga I le vaingo tato totong o le tutino o le tato manava. Ia pe o I le tau po anga I le tanuanga tau. Ai whatau tonguala I le vainga le tau le hookworm. Ia po le anufe matau, le pe na I loa tato mai Pasifika. O le talanola po le hanmea linda whaisu suenga I la toni scientisi I nei mea o le anufe matau. O le baba ila to po le hasi ta ua ma le au ngā o le nufe matau te tongu tato manava. O le lana whatala noe e la to lana amai ala matanga. O le ele o iei, ele o mautino le leipo iei se au ngā tele mo tono to tongo tato. Au le mena e alena whaile susu e ngā la to lo whaia nei. O le alai baba ai po le atonu ale le mea au ngā ile le ukwem. Ai iei fo ia to e ngā nufe nei. Ele au ngai mama I tātou pe a tele tono tātou manava. O le lana mailana I tanoanga whatanoanga e tuse a mea lo tupu nei na ta ule upu le o le hygiene hypothesis o le autoimmune o le vaenga le e toe nofua isi vaenga o le tino me toe pe e whaasanga tau isi vaenga o le tino. O vaenga lana o le whaisusu e au fiela ma le nufelia po le alona tā ue te tono tātou tino. O le situ langa le pena wa ilfisue ingo so fuanga temine o tele ina mama tele tato ia pe o le to tele ini vaenga te le tino lona ia lava to tongo tato I meo ne pe ona ola mai tato le Pasifika male vaenga mulmuli lenta no ai o mene o hookworm ia e moa I le lavi e pole tamai anufele a fo I pa o le taimi fo mo le fo moa o le na moa le o le lava ma foi ma moela I ole nufelia ai ma na va tato na lu le tono to ole mama ia langs ia na lu paseto de ilalu ia tele aftu ia ai pe na on motor Pasifika wa ve bela e ma wai o nei New Zealand ele o la le ko e mlanga malu tele ia mela na le o te o ma o le to mo tato were you describing how you pick up from soil then reminds me how I ran around when I was a kid, no shoes on my feet, and obviously you pick them up very easily from all over the soil in the Pacific. And when you come here, your feet are well covered now, so you don't tend to figure it out.
And you might never know that you're infected with hookworm. All you might see is just a little tiny rash that could be from anything, very non-specific, and often they don't give many symptoms.
So I was going to ask the question, so how do I know, or any one of us know, I've got hookworms in me?
Yeah.
So it's through rash? What else?
Yeah, so when you first get infected, you get a small rash.
Yes.
If particularly a child is complaining of abdominal pain or an itchy bottom or diarrhea, a GP may do a poo test to test for the eggs for lots of parasites, not just hookworm, because as I said, when we talk about hookworm, we're talking about one particular type of parasite.
Yes.
And so there's lots and lots of different parasites in the soil which you can pick up, and so you can do the stool test and look for eggs. But particularly at low doses, like in the people that we're infecting, actually often they don't get any symptoms whatsoever, and so that's why we think it could be really useful as a treatment, because people can just potentially get on with their life and do their normal things and just have this infection sitting there and maybe not have to take medications. We're not there yet, but that's what we'd like to see.
Just a small irritation, but it's like benign.
Yeah, that's right. And often it's just for the first few weeks, and then as it enters this chronic phase of the infection, which it can be in for years, you actually don't get any symptoms and you just feel normal.
Yeah. Ole vaingalen tala no nei mo le afo le anu fele pe tono tato tino. Beisi te me le faina tele mo tato e de ono ai pe lo le mele le ta ole po le rash e po se sa mai se mo le tino e pe o fai longa na ya na fo pe mangeso tulo la fa fonga le tunu mangeso lo no fonga e tele ai alu vai le fo mai e ona siaki la e o ia po ye ni mo x dena ta oia ai le fa pe na ole anu fe mata mo e mo fo isito ai nga siama po parasites le ta oia e fa yesu su nga na baile yo tong fitinga mo tato. So whereabouts in your body do these things? Well, I mean, obviously they got a favorite spot inside your gut where they live. What do they normally? Small intestine or the big?
Yeah. So the top of your small intestine.
Right.
So you've got your stomach, and then it goes down into your small intestine. Your small intestine's made up of your duodenum, your jejunum, and your ileum. Your duodenum's at the very top, and that's where they live. And the reason they live there is because in your intestine you've got these tiny little finger-like projections that increase the surface area of your intestine so that you can absorb nutrients.
Right.
Well, the reason it's called a hookworm is because its mouth is a hook, and it's the perfect shape to attach onto one of these little fingers, and where it can just suck on there and just suck a little bit of your blood all the time and live off that blood.
So it's eating the nutrients before it even gets to the other organs.
Tiny little amounts of your blood. And we actually think when it's hooked onto there that it might secrete these molecules into your bloodstream that might suppress the parts of your immune system that might cause disease. Yeah.
So you're trying to find out whether some of that can be adapted to be useful inside of us.
That's right. At the Malaghan Institute we've got lots of thoughts about how hookworm might be beneficial,
right.
Because this idea has been around for years, and there's lots of people in New Zealand actually buying hookworm off the internet, importing it and dosing themselves. Now the problem with that is that the evidence that it works isn't there. There's lots of anecdotes, lots of stories, but without that really good evidence, doctors don't want to prescribe hookworm therapy, and so we're trying to actually work out by doing good clinical trials whether it's beneficial or not, because it might not be beneficial, and if it's not beneficial, well, that's still useful that we've found that out, because we can inform people that actually what they're doing isn't working, and we know that lots of the medicines that we prescribe do work, and so At the moment, I don't tell my patients to go buy hookworm because we know that our conventional medicines work very well, but this is just perhaps another medicine that we can use in the future. But at the moment, it's not there yet.
Is somebody have a business of actively marketing or selling hookworms for people to?
So you buy them on the internet, and you import them, and the one of the issues with that is there's a concern that perhaps you're not importing the right worm, because as I said, there's lots of different types of parasites. Yes. And there's some dangerous ones that if you dose yourself with the dangerous ones, you can get very sick. And so there's no quality control to say that what they're actually importing is human hookworm, the one we're using, and they could potentially be bad hookworms. So I definitely don't recommend people buy them off the internet because they don't know what they're getting.
I never knew that people go and buy hookworms. Yeah. Some people want to get rid of them because there's irritation inside them. But
that's right, and I would still, if someone's found to have hookworm at the moment, I would still recommend people get them killed, get them treated, because we don't know yet. But it's a really interesting idea that we're trying to work out.
Ole vaenga len tala no le I po fio tono le tino pa le fiele le nufe mataule olai. Ole saunanga atong mules o lunga o le pito I lunga o le tato nga autulo lava le pito I lunga I le small intestine ma le large intestine o le vaenga le lunga le vaenga le pito I lunga o le tato nga au le o inala pe olai el watu pipi I me je tonu le na fa matala I o le pasi to ia tau ia me ai ta wo mo tato tino ia ona no foi le matauta wo na ma fa nga fo ia ni so vaenga ia le tam fatino e mo mia. So you can't afford to have too many of these hookworms hooking all your follicles in there, because otherwise they'll be sucking all the nice nutrients.
Correct.
And denying the person.
Particularly one iron. Iron is the one that if someone has too many hookworm, they can become deficient in iron.
Okay.
So that's another example of if someone's got iron deficiency and some gastrointestinal symptoms to check for hookworm, because if you've got too many of these things and it's sucking too much of your blood, you can get iron deficient and you can get sick.
So obviously, like you said, there are bad hookworms and some which are trying to find out the real value for us. And then the good ones, how long are these things? When they start growing out inside of our bodies, how long do they normally grow up to?
So when I first talk to people about the idea of taking hookworm, I think they have this idea in their head of these big worms that you often see on television, or people are pulling them out of their skin, or the ones we're using grow to about 0.5 centimetre. So they're very, very, very small. Yeah. So and when we infect someone with them, the larvae that we place on someone's skin, microscopic, you can't see them visually. Right. So tiny. So I quickly tell people that it's not these big worms. It's these tiny little things, and people feel a lot more comfortable about potentially being infected.
Was it easy to find candidates to be injected with a hookworm for this research?
Yeah, good question. So we've done 2 studies at the Malaghan Institute. The first one is in healthy volunteers. So these are people without any diseases who are interested in hookworm as a potential therapy and in being involved in clinical trials. And that's because we really wanted to make sure that they were safe and that the methods we were using at the Malaghan Institute could set up a good infection, a viable infection in the body. And so we've done that, and it does look like a good infection. They look like good hookworms. So then we've just started treating people with a condition called ulcerative colitis, which is an inflammatory bowel disease, which is a particular area of interest of mine, and that's a chronic inflammation of the colon, of the large intestine, and so that's a type of autoimmune disease.
Yeah.
And so people, when someone has the disease, I think people are more inclined to get involved in these studies because they want to help themselves, obviously, but a lot of them see it, they know what it's like to have these diseases. So if they can contribute to evidence, if they can contribute to medical... So it hasn't been particularly hard to find people to get involved in these trials.
I was just thinking while you were talking about having live candidates for these research, there must be a process between the hospital and the GPs to refer some of these patients into a database, and then you researchers go and say, oh, I need that person, see if they can give us the consent to work with them.
Kind of. I mean, I'm a gastroenterologist at Hutt Hospital, and so I look after people with ulcerative colitis. And so I have a lot of experience and develop relationships with these patients, and so I contact them and I ask, are you interested? If they're not interested, that's fine.
That's right.
If they want more information, I provide that, and then there's this big process of going through consent with them to tell them, what are the risks, what are the potential benefits, do you want to take part in the study? So this process of contacting the person, the patient, to actually getting them into the study is a long process, because we want to make sure they're happy to be involved.
Perhaps I should try and persuade our listeners, if you want to volunteer, when you have to say, by the way, if there's somebody who's doing research, offer my name forward so they can, have candidates. Ole vaenga le matata noa I whaanganga o lato fo I suenga. O le tala noa I vaenga ese o loo tamo whai e whaonga nisi o loo mau ngase ina ia whaonga ai pe o lato tonu lava o le Malaghan Institute o le tangata le leo lato so fua maloloina o na avele o le anufe lea matau o le Hookworm ia matu tonu ai se vai po le ale swing o lato ai e fo isi o ele o malolosi ato toa ia ona whai e fo ilo lesi vaenga o susuenga ina ia maua lato ia ni vaenga e tā ua mo lato susuenga. I think we're going to have a little break, Tom, and then we'll come back. And I just want to check, exactly what is the desirable outcome that you're looking for out of all this. When we come back, we'll have a piece of music now from Tess. So if I tell off to tata o whafonga o mawhatasi ma Dr. Tom Mules, e pe ona tomo mai o lo whainga luenga le Malaghan Institute, ma o ia fo se fo mai le Hutt Hospital, e whane mai I loa Hutt. I manei fo I atonu e nisi o tō ngase e whane mai o lo vai mai fo I lunga le Facebook le tau nei, o lo mawelo na ata e pe ona tana whatana no le tau nei. Ma tatanoa tu le nufe mātau po le Hookworm, ia masusu enga lo whaine le Malaghan Institute pe iesia o ngā mo tātou tino. Ia o vainga nei whaisusu o ngā scientists. The hookworm, how long do they live in our bodies once they get the luxury of accessing our small intestine and then get the good feed out of the nutrients in there?
Yeah, really good question. So the reason we're so interested in hookworm is because they can live in the body for a very long time.
Right.
A lot of these parasites die very quickly because your body recognizes them as foreign and sets up this big immune response against them and kills them, or they make you very sick because your body's constantly trying to kill them. But hookworm seems to develop or get into this harmony with your body where it's just sitting in the small intestine and your body doesn't think it's foreign anymore and just is happy with it there. And so one of the reasons that might be is because it's regulating the immune system. Maybe it has these molecules which it can secrete into your bloodstream which suppress the parts of the immune system that try and kill it. Now those same parts of the immune system we hope are the same parts that cause these autoimmune diseases. So potentially we think they can live in the body for 5, there's some documentation maybe 7 years.
Sort of I was just thinking of the parasite and what it does, just sort of freelance, sort of lunch and breakfast.
Yeah.
Well, for 5 years, 5 to 7 years.
5 to 7 years, just tiny little amounts of blood. And so is it that the body's benefiting from the hookworm and the hookworm is also benefiting from the body? And so you get into this harmony, this equilibrium of everyone's happy, why should we try and kill it?
So has there been a discovery of how it actually gets into harmony with our body?
Yeah.
Is that part of the research?
Yeah, that's a lot of the work that we're doing. There's a lot of theories about why it might be beneficial. There's these really interesting immune cells called regulation T cells that keep the immune system in check, and the thought is maybe the hookworm increases the amount of them in your body.
Okay.
And so they help to suppress the other parts of your immune system or regulate the other parts of your immune system. One of the other interesting areas or one of the other theories we have is the immune changes may actually improve the lining of your intestine. So your intestine has this lining, which we call the intestinal barrier, which has to be semi-permeable, so it has to be able to let nutrients through, but it also has to block bacteria from entering the body, because your intestine is filled with trillions of bacteria, fungi, and viruses. And so your intestine needs to stop all these entering your body, otherwise you'd get very sick. And so one of the theories is, could the hookworm be changing the lining of your intestine to prevent entry of all these bacteria? And this might actually be why the autoimmune diseases are reducing, because increased entry of these bacteria have been linked to increased rates of autoimmune diseases.
So it'd be a good thing if you discover that it's actually doing that, performing that task.
Absolutely, that would be really good, because one of the key theories really is that the rates of autoimmune diseases, allergic diseases, even metabolic diseases like type 2 diabetes and obesity change the permeability, change how many of these bacteria or fungi in your gut can leak through your intestine, and they can contribute to these diseases. And so there's a lot of work going on at the moment about how we can improve your intestinal barrier.
Thank you. O le vaenga le tala no ne apsiri po le ale le umi o le lapo po o fo o mene o nufi le tun tato tino. Ia o le fa pe e te ama le afa centimeter le lapo. O le ale umi o le tono tato tino e lima i le fitu tau sanga. Ia o loinga le o la fo e tau si tono tato vaenga le o tato ngā au se tulou lawa. Le e pito lunga le la titi. Mai e fōringa mai o lo o iese ngā luenga o me tono le whaisusuenga. Po le ase ngā luenga tā ua o lo whaia e nuwhi tono tato tino. E alai ona umi ona i tono. A wai peona tā ua le Dr. Tom Mules. O le o tato tino watu e lo se siama po se mea mai whafo. Nofo lo le tino ma whaise au wala ina ia a le tape, ina ia ese matono tato tino. Ai maua nei susuenga. E pei e masani le leile le vaenga le o tato tino ma Hookworm po le Inflammatory. Le leina umina na o le tonu. O le ma autu tonu na susuenga. Po le ase ngā luenga le lei o lo whaia le nuwhi le tono tato tino. E au ngā mo tato, maenga lana o le tau la i elwa ai. Po o le ale tau o fua i le mawhai ona o la umi le lima le fitu tau sanga. Le nuwhi ma tau tono o le tino. Now, I guess we just started leading towards whether it can actually help improve the immune system. And that would be the question, are they likely to improve our immune system? That's what you're hoping to discover.
That's right. That's right. And we're doing lots of work to look at how it affects your immune system. One of the issues we're coming across is how complex your immune system is. It has lots and lots of signals coming in from everywhere, and perhaps how your immune system is primed from when you're a small child and you get different infections. Everyone's been exposed to different infections, might impact how you react to hookworms. So maybe not everyone reacts the same way. Some people might react how we want them to react. Some people may not react like we want them to react. And so can we work out before we infect someone with hookworm who's going to react how we want them to and who's not, because it seems like people react in lots of different ways because everyone's immune system is so different.
Yeah, but are all hookworms the same, or have they different, like people like us human beings?
Really good question. We don't really know. It's very hard to look at an individual hookworm because they're so small to look for key differences. And at the moment, we don't actually really know what we're looking for, what it is in the hookworm that seems to be making these changes. So working out which is a good hookworm, which is a bad hookworm, that sounds like an amazing idea, but at the moment, we're just not there.
They're all much of the muchness, they're all the same.
Probably not, but you know, they're tiny, they're minuscule. So working out, we struggle to work out how our immune systems differ, let alone how a tiny little hookworm's immune system differs.
Yes. Ole vainga le tal no ne iai. I te tono tato tino le vainga le ta ole immune system. Po le ngad wenga tono tonga tato tino vainga tato tino te to inga se ngase po fa mai tuku tono tato. Ole sila vainga le ole va vai po le tono ale ngad wenga le nufere pe mafai fo yo na faise awala. Ina ia ngai le nufe tono tato tino. Aya mai fo susu nga le ya se me ngai tono tato tino me sidi le wala to malama fo le vainga pe on tam fa susu nga. Ona fasila ia mai mau pe nei loa e tutu sa mai anu fe o tono tino i le tali de ai le fai ona i lo te minei mai mau pe nei lo fa ngofia ona fi anu fe ta o mo tato ta se al me le la to lo ia vai nga ta o lo tam fai fa mai I vai nga le. So we've asked about the immune system. The gut sort of work that you working at. You talk a little bit about that. Some of the work that you're involved in.
Yeah, well, I suppose being a gastroenterologist, I'm very interested in gut health.
Yes.
And I think more and more evidence is coming out that how important your gut health is to the health of the rest of your body, whether it's your brain through this idea of this gut-brain axis, or whether it's changes in your intestine can actually contribute to diabetes, obesity, and these autoimmune conditions that we've been talking about. And so one of the theories about why these conditions are increasing is that a lot of the things that we put into our mouths, we eat, are actually damaging the lining of your intestine, leading to gut barrier dysfunction. And so, you know, things like emulsifiers or preservatives or pollutants affect our gut and our immune cells in our gut, our lining of our gut, and probably contribute to disease. And so, you know, a lot of my patients ask, you know, because I think there's a common belief, particularly amongst people with gut conditions, that how much better they feel if they eat healthy, and how actually eating healthy can have a big impact on their autoimmune disease. And so they all ask me about what they should eat, and that's really a really difficult one, because it's hard to do studies on individual foods, but we do know that all these additives to foods do impact on your gut barrier. And so I just tell them to eat healthy, go back to basics, lots of fruit and vegetables, try to limit the amount of these added foods, try to limit fast foods. You know, it's not difficult in terms of what you think you should eat. That's you know, it's pretty common sense. The difficulty is that perhaps eating these basic foods actually takes more time to prepare. It may be more expensive, and with the amount of preserved foods in the supermarket now, it's sometimes a lot easier just to buy, you know, pre-prepared foods. But I just tell them, get back to basics.
And that's one of the big changes in the lifestyle of Pacific when we come here.
Yeah.
All of a sudden you go to the supermarkets.
Yeah.
And now they've also taken the supermarkets to Samoa and the islands. So now you change your food, your intake.
Yeah. And that's all over the world. And that's one of the theories why there's these increasing rates of these diseases, because our diet has changed. And I really just stress, you know, what you put in your mouth is really impacting on the rest of your body. And so really being conscious about what you're eating is my biggest message to patients.
One of the things I mentioned before, that we've been doing this health project since 2018. We've interviewed dietitians, nutritionists, and I said to them, why don't you give me a list of food that people should eat? And if only you can look at a table and say, if you eat this much, you'll get this. Or perhaps tell some of the things you're just talking about, it's bad for your health if you eat that sort of food.
Yeah.
But nothing is there that actually tell you, and give you a list of food which is affordable to some people.
That's right.
Because it's very hard to buy fruit now in the supermarket. They're quite expensive.
Very expensive. going to, you know, your farmers markets, you know, and buying all your fruit and veg from there.
Yeah, we encourage them to do that on the Saturdays.
Yeah, absolutely, and just staying away from those pre-prepared meals, staying away from your fast food, if possible. I mean, like our lifestyles change as well. Everyone's busy. Everyone's got to maintain a job. And so it's very easy to go and buy takeaways on the way home. That's an easy thing to do, but just be conscious. And I'm not saying never do that, but just you know, reduce it and just try and be conscious about what you're eating.
Yeah. O le vainga le tau o te lea o tau mafa po o tato food intake, le tau mafa le ave tonu o lo tino. Tu sa o e te wawa ia ma puipuia o e pea e tau mafa palini. Po tau mafa I tala whea ngaima. Ai le whautuanga awane I te le tato I fast food, ia po me ai e whatau mai ia KFC, me whapena e leo ngana mo tato. Ia po isi me ia o na ngausi, ia na mai lola ia kuka pe whaavela ma tau mawhai tato. O a waenga na le tele na awhia ili tono tato manawa po lo kat pe on tau whaamatala e tato format, e scientist. Ina ia mawhai e o na whasosoni o tato soifua malaroina. There's the other saying, you reflect what you eat. So if you don't eat healthy, you don't look healthy.
Yeah, I 100% agree with that, yeah.
So, you know, what you've just been saying, you know, so you control what you put inside you.
Yeah.
No one puts that food inside you except yourself.
Yeah. And I don't think people realise how much better they will feel if they eat well. Yeah.
Yeah. Ole vaenga le toi ma mawhana le vaenga pe on sau noia tong. Ta ua ia lo wawa ai tau mawha e te whaangaina. Wai o I ngā fo I mo I lo golo so fua maloroina. Ia le sama tano fo I tau o whala ama me ai tau mawha I tono whale o loa supermarket. Whai esin tang tā. Ai le fo I fautua ina ia wai tato marketi a stonai. Wha tau ele I o to ai ngā me aina tau mawha o ngā mo tātou. So we talk about the bad hookworms. What if somebody's got a bad irritation because of the parasites or hookworms? What is our current treatment for these things?
Yeah. So as I said, if your doctor diagnoses you with a parasite infection, at the moment I would say get it treated.
Yes.
Because we just don't have the evidence that hookworm actually works yet.
Sure.
The treatment's very, very simple. You know, we've got very effective treatments against hookworm and the other parasites, and that makes it really attractive for people to participate in our trials as well, because I tell them that if you don't like the hookworm, if you want to get rid of it, I can give you a tablet for 3 days and it will go away. Okay, so very, very effective, very easy to get rid of it. And I know I'm not sure about the Pacific Islands, but in a lot of countries, particularly some African countries like Namibia, they've got big programs to kill parasites, and they've got where they go into schools and give school children anti-parasite medications to because it's so common there and it can affect you know, their weight and
but this treatment
nutrition.
is easy to access.
Absolutely. Okay. Yeah, it's just a prescription from your doctor.
Ole vaenga le tano le a te o maua o anu fe ia po anu fe matau po se fo to inga anu fe faima fa lave ia o ia o lo faingo fiena mo se fo la awinu ia na fa te ai la ia. So we were looking at the type of disease that can be treated. So I guess once you find out how helpful the hookworm is, then you'll be able to determine what disease it can be treated.
Yeah,
is that right?
And there's lots of anecdotes of treating lots of different types of conditions, and so we know people are scattered around New Zealand who are trying to use hookworm on this hookworm black market to treat lots of different types of conditions. So you know, people want us to try it in their condition, but we've picked a few conditions to start with. Right. And then if it looks like it's working, then certainly move on to other conditions. A group in Australia who we do a lot of work with are trying it in people with metabolic syndrome, so that is obesity, type 2 diabetes, and their results should come out in the next couple of years. And a lot of that is to do with the intestinal barrier that I described, but also that having diabetes, being obese, causes inflammation in your body, and so actually by reducing that inflammation, can it make you healthier?
So the people who are actually grown out of the normal shape, what shall we tell them to take up or look at? It's some kind of helpful health
in general. So I think we've talked about the eating.
Yes.
It's about, most of weight loss comes down to how much you're putting in your mouth. A bit of it comes down to exercise, but most of it comes down to the amount of calories you're eating. And so all the things we've talked about going back to basics, eating lots of fruit and vegetables, staying away from processed foods with very high calories in them, is really, really important. And I would really try and engage with your GP about weight loss, because there's lots of help that they can offer to help you lose weight. But it does come back to what you're putting into your mouth.
Vainga le tau o tele mo la tau fo o le tau whaitia le o la tau tino. Ia leo toi whaamana tūlanga ia masane o la vai tau mawha e whaamai. Awole e whaamai a mea aia le tele na whaatau mai whale ainga ma ave pe o nā le tele na mau e tātou I tūlanga ia. Ia matau mwhai e so tai lau ti pi polo fo mai. Ina ia tano so soani a oe I ronga I tūlanga o iei oe. Ia pe o vaenga na o le tau mwhai whaamanato tato po kalamere e stay muri no to tau mwhai le toi whaliri watu si vaenga le tau tutuli a le tato tanoanga. Ia mo le taimi o awanoa mo tato. So the research you're working on and Malaghan Institute, how long is this going to be, and when do you think you'll come up with yes, this is what we can do with this research now? This is
I think you've written the Eureka moment.
When is the Eureka moment?
Since getting more into science, I've realised these Eureka moments don't come very frequently.
No.
It's more of a slow grind.
Okay.
It's about ticking little things off instead of suddenly having a day where you discover something amazing and everyone's jumping and excited. So it's a slow process. And to actually get something from the lab into the mainstream where someone could go to their doctor and get prescribed hookworm takes years. And I think if it works, that's probably 5+ years away. But it might take us 2 or 3 years to actually work out whether we want to proceed with that because we think it's going to be useful, or actually whether we can then tell people, actually, this hookworm doesn't work, which I think, that's disappointing, but it's still really useful in terms of a contribution to medical literature, because, people have had this idea for a long, long time. So if we can put it to bed, that's also amazing. If we find something that works and we can help people to treat their disease, that's even more amazing.
Or anything whether it's a negative outcome, at least you'll actually sort of bust the myth of these people in the black market trying to sell his hookworms.
Exactly. Anything that we can help inform patients about their health is really, really important.
Ole vainga le peto whanongo mai I le umi e whai suenga nei ia ole whamai ole po le 5 pe lunga fwtau sanga. Ai te tono lua tausanga e ono maua I la tau te afo se whaaringa pe au ngā ona whaawau pe rei foi. Ai tusa pe mo mai e reisi au ngā o le hokoe mo tatou tino. O le metau ria a mo me susu e ngai reisi au ngā. Ona mawhai lola ia ona whaamatala ma whaalau loa. Ina ia awa foi istangata pe la te loa ele tūlanga o le hokoe mai maua taimi. E pe o le maua tu e tangata le o whaatau le black market po Tom, thank you very much for coming and sharing this with us this morning. You might have a final comment or message for our community, and also we've been trying to persuade everybody to get jabbed.
Absolutely, I couldn't stress that enough. That COVID-19 is bad, and when it gets into the community, it's going to make a lot of people sick, and it's the people that aren't vaccinated that are going to get sick. And so getting vaccinated for yourself, but also your family, your friends is really, really important. From a hookworm point of view, I don't really have any other comments except to say, once we have the answer, I'm very happy to come back and talk to your listeners. But as I said, that might be a few years away.
And if you're looking for more volunteers, ring us. We'll find some for you.
You're volunteering, are you? Yeah, good.
I want my hookworms back. I want my hookworm.
Everyone's heard it. I'll take you're locked in now.
I used to have them before I came here. Then I was told to take these tablets and kill them before I even left Samoa. Yeah, ole tulanga na tato por kalame ma Tom Mules now. Ia le foto tatan noi. Ele tulanga ma fa malo si au fo ela tole fai tui mo le COVID. Fa mo le fai o tui. Ia ai to fo mai fo tato ta po le hookworm. Ia o nai fai sui a fa pe fo ye ni se fia a waile lato susu nga ia fai ya na tu mai le ngo I ona avede ia. All the best for your research and for the rest of today and the week. And hopefully we'll hear some good news from you within the next couple of years.
Thank you very much, Afamasaga.
Yeah, thank you. Yeah, o tato por kalame na vai tu fata si male Dr. Tom Mules style nei, tan no fun ta ola I ole anufe mata. Ai sistemi to tan no tem nei mat fato fa so fu.